The Niagara Folk Arts Multicultural Centre, in partnership with Quest Community Health Centre, is proud to announce the launch of a new primary care service dedicated to uninsured individuals within our community. Joining me in the studio from the Folk Arts is Executive Director Emily Kovacs. Emily, thank you so much for joining me here in the studio today.
My pleasure. Thank you for having me.
Of course. So why don't we get right into talking about how this program is aiming to bridge healthcare gaps. Can you share how this partnership was formed?
We actually started with a research or a needs assessment that started way back in 2019. We did a needs assessment for all of our clients, and we noticed that there was a significant number of them, I think over 75%, who were not connected to a primary healthcare provider. Not unusual. We know that among Canadians, 1 in 4 are not also connected to a primary care provider, but in the newcomer population, 3 in 4 is a little bit higher. So that was the initial process, and we've been working in partnership with Quest Community Health Centre to see how we can bring about bringing a primary health care into folk arts itself. And then, of course, in 2021, we also added the Migrant Support Workers program, which brought additional migrant support workers in the area, which then again escalated the need even further. And then we started more conversations, and then fast forward to today, on November the 4th, we started the very first clinic, and we started with a MOU that we also signed with the Quest Community Health Centre.
And so what are the hours of operations and how does it work?
So it is usually once a week, 1 to 3 p.m. The Quest Community Health bus arrives to us. They come around 12:30. What we do is we identify any and all clients who are at our center. The only question is that we ask is, are you connected to a primary care provider? It doesn't matter if you have status or you don't. And if the answer is no, they get on the list. We have a wait list already. We see about 8 to 10 individuals on any given clinic time. We take individuals and look at their needs. So if they need interpretation, look at what kind of triaging they need. So, if you are in a health emergency, you're not a candidate for the health bus. But if you have, things that can wait for an appointment time, we'll get you there. If not, then we'll send you either to a walk-in clinic that's immediate or to Emerge if it's urgently needed. So roughly every Monday, 1 to 3 p.m., you can expect the bus to be with us and about 8 to 10 clients receiving primary health care.
And what would be some of the services?
So it is primary healthcare, so basic things about needs assessment. So, prescription fill-ups, needing a referral to a specialist, gender and reproductive health care, immunizations, flu issues. So basic things that can be addressed in a primary health clinic. And the wonderful thing about the inclusion of our partnership, along with some existing supports, is that we have internationally educated health professionals who work with us as health navigators. So if there are referrals that need further follow-up, we refer them to in-house health navigators, or if there are specialists that are needed, Quest will take the lead role on it. So we came up with a client flow as to who's supporting whom and what the follow-up will look like in a case management model.
And what about someone maybe, what could be considered logistical challenges like transportation, location accessibility? How are those being addressed?
So our main building is accessible, so there's an elevator. So if you needed to go use that, that's addressed. As I mentioned, interpreters, either Quest or us, we can both have access to interpreters. Transportation, we do have funds for transportation for eligible clients at our services, and also even for our neighborhood. So individuals without a fixed address live in our neighborhood. So if they are looking for service touch points, this is also a good point for them. And if anybody has transportation issues, they can just contact us and we'll provide bus tickets and access to transportation as well.
And I think hearing that you have interpreters for different languages is so important for this segment of the population. How important is it? Do you find that this is often necessary?
It is. The the languages or the issues that individuals face when they come to Canada. Language is a primary connection, and also health literacy itself. So not just not speaking English, but not speaking the basic health literacy issues that come up with having to articulate what your needs are, knowing what the health resources are available in Canada. What does primary health care look like, and what is the ecosystem of the health system in Canada? So there's a lot of health literacy that needs to be addressed along with interpretation. And the good thing is that we have internationally educated health professionals who speak a number of languages, so that's addressed. And then from the Quest side, they have access to an online interpretation service, and their interpreters are also trained in specifically health-related issues.
Oh, some wonderful information. Now, why don't you also tell us a bit about the holiday newcomer market that you have coming up on December 10th?
Yes, so December 10th from, I believe, 4 to 7 p.m. It's in partnership with the Performing Arts Centre, so the First Ontario Performing Arts Centre, our wonderful friends. This is our second annual holiday market where we are showcasing the entrepreneur talents of newcomers. There's also a play that we're going to be watching together, and individuals who attend the play can then access the holiday market, which will be set up at the Performing Arts Centre. So you can do some good and do some sort of social conscious purchasing by supporting women and Indigenous and newcomer individuals who are offering their goods that they have prepared.
Excellent. Well, thank you so much for coming in studio today, Emily.
Thank you so much for having me.